So once we know the covering, now we will go to the various parts of the gland. So as already mentioned, it has got an inverted pyramid shape. So the parts includes the base, the apex, various borders, 3 surfaces, and another important part is nothing but a duct, which is known as parotid duct. So these are the main parts: apex, base, 3 surfaces, 3 borders, and an important duct, the parotid duct, otherwise known as Stenson's duct. So parotid duct or Stenson's duct. And one more process in relation to the parotid gland, which you must know, is known as accessory parotid process, which is nothing but sometimes an extension of the gland will be coming anteriorly towards the duct, which is known as accessory parotid gland. So these are the main things you have to know about the parts. Now we will go to the details of each of this part. So first, the apex. So this is the apex, okay, and the main structures which are in relation to the apex: vein, which is known as retromandibular vein, okay. So there is a vein in relation to the apex which is known as retromandibular vein, and one nerve which is nothing but the cervical branch of the facial nerve, okay. So there are 2 veins, 2 divisions of the retromandibular vein, and a nerve which is known as the cervical branch of the facial nerve. For time being, just remember this, the details I will explain. So from the apex, 2 structures, one is 2 divisions of retromandibular vein, and one more structure which is nothing but the cervical branch of the facial nerve, okay. Then we will go to the base, okay. So if this is the gland, this is the broad base, this is the apex. Apex, 2 structures, retromandibular vein, the divisions, and the cervical branch of facial nerve. Coming to the base, okay. So the base is little superior. So the base is otherwise known as the superior surface. So the superior surface is directed above. It is little concave in nature, and the main structures passing through this base includes temporal branch of facial nerve, okay. So there is a temporal branch of facial nerve, vessels, superficial temporal artery and vein, superficial temporal artery and vein, plus one more nerve which is known as auriculotemporal nerve. So we have the structures, passing temporal branch of facial nerve, then the superficial temporal vessels, plus one more nerve, that is the auriculotemporal nerve. So these are the structures in relation to the base. Now we have other surfaces. So suppose this is the gland, okay, the base, the apex. The other surfaces, 3 surfaces, they are superficial surface or lateral surface, anteromedial surface, anteromedial, posteromedial surface, okay. So to know the surfaces, we have to know the boundaries. So we have got 3 borders. The borders are, one is the anterior border, the medial border, and the posterior border. So this is how the gland is. So whatever we are seeing, the parotid gland, it is mainly the lateral surface or the superficial surface. Okay, so this is the surface which we are mainly seeing. Okay, parotid glands, superficial surface is the surface which is visible. So the borders, once again, it is the anterior border, the medial border, posterior border. Okay, so between the anterior border and the posterior border, you have the lateral surface or the superficial surface. Between the anterior border and the medial border, you have the anteromedial surface. And between the posterior border and the medial border, you have the posteromedial surface. So these are the 3 surfaces: base or superior surface, then we have a superficial surface, anteromedial, posteromedial surface. Okay. So all these surfaces are in relation with certain structures. Among that we have seen the superior surface or the base. Now we are going to see the other surfaces. The most important, the lateral surface. So the structures in relation to lateral surface, the surface. So what will be the structures? The structures which we are seeing, the skin, the superficial fascia, the deep fascia or the parotid fascia, plus certain structures like the fibers of platysma, then the branches of one nerve, that is the great auricular nerve. So all these are in relation to the lateral surface or the superficial surface, the relations. Okay. So skin, superficial fascia, deep fascia, then part of the parotid sheath, the parotid fascia, branches of great auricular nerve, fibers of platysma. These are the relations of the lateral surface or the superficial surface. Then we are going to see the other surface, which is nothing but the anteromedial surface. So this will be the anteromedial surface. So it is related to the inside structures, the muscles, mainly the muscles in the anteromedial aspect, which includes this anteromedial surface. It is mainly grooved by the ramus of mandible, plus the structures in relation to them. It includes the masseter, the medial pterygoid. Okay. So this is the anteromedial surface. So the muscles inside, which is nothing but the masseter, the medial pterygoid, plus it is grooved by the ramus of mandible. So these are the main relations of the anteromedial surface. Now one more surface left behind, that is nothing but the posteromedial surface. So the posteromedial surface, it is extensive in nature, which is facing posteriorly. Hence it is in relation to the posterior structures, which includes mastoid, styloid process and the structures in relation to them. So the posterior surface is in relation to the muscle sternocleidomastoid, the styloid group of muscles, posterior belly of digastric, plus mainly two vessels are there in relation to the posteromedial surface, which are nothing but our carotid vessels, the internal and external carotid arteries. Okay. So these are the various relations of the surfaces of the parotid gland.